So how should you choose a cardiologist for your heart health? So there's a couple of different things that you should be looking for within a cardiologist when you're making that decision. Obviously, clinical decision making is important, but even beyond that, how can that individual take into account your individual preferences? Within cardiology, many of the decisions that are made really require both the physician or the provider to be talking directly with the patient and sharing that decision-making process, whether it be for medications that you're going to use for a heart arrhythmia, medications you're going to use to try to control chest pain, whether you want to undergo an intervention or a procedure or not. All of those decisions should be decisions that are not only made by the provider, but also shared with the patient allowing really opportunity to give feedback. So you should be looking for an individual that really makes that an important part of the caregiving process. Heart healthy behaviors involve a couple of different things that you can do easily in your everyday life. So first and foremost, if you're smoking or using a tobacco product, I always recommend that you work with your provider to try to figure out ways to stop that. That is one of the biggest risk factors for both heart disease and for leg disease or peripheral vascular disease. Number two, what does your diet look like? Going to fast food places, try to avoid that as much as possible. Eating lean meats, vegetables, getting an adequate amount of exercise. Start where you're at right now. If you're not doing much exercise, don't try to run a marathon tomorrow, but get out, start trying to walk, if at all possible, in your neighborhood. So 30 to 40 minutes of aerobic activity 3 times a week. And then obviously talking to your provider about individual ways that you can increase your heart healthy behaviors.